I'm Dr. David Ajibade. We're talking about sickle cell disease. In previous videos, we talked about the sickling effect and how the main problem with sickle cell disease is when a normal cell, a normal red blood cell, transforms into a sickled cell. And that's like the root of all evil, so to speak. All kinds of problems can arise from that. So in this video, we're just going to talk about the forces acting on the cell, on the normal red blood cell, or the normal looking, I should say, the normal looking red blood cell, making it convert from a normal looking red blood cell into a sickled shaped cell. First and foremost, especially in our environment, our Nigerian environment, because of all the tropical diseases and the climate in which we live, I'm going to put at the top of my list infection, because it's all around us. If you in your body right now, you might be having malaria. I think everybody has malaria parasites. It's just a question of the degree, the extent to which people have the malaria parasites. At a certain level, you develop the symptoms, but everybody has it. A lot of people are dealing with all kinds of infections here and there, typhoid, etc. And so the reason why we're not coming down with them is because our immune systems, for the most part, are doing a good enough job of keeping these away. But with sickle cell disease, in children and adults with sickle cell disease, the immune systems are depressed for about 3 reasons, and we'll talk about that in another video. So infection is very important. So it's that can trigger a crisis. I'm going to just skip to different things. I'm not going to talk about everything because we don't have the time. But emotional stress, we've seen patients who are doing very well, and they now have exams coming up, and all of a sudden they have crisis. That's because this emotional stress can produce chemicals in your body that will affect the red blood cell and make it more prone to sickling. Changes in temperature, too hot, too cold, can trigger a crisis. And just changes, like sudden changes. Like, for instance, you take a child you wake him up in the morning, he wants to have a bath, it's a cold shower, and all of a sudden his blood vessels constrict, and then he has a crisis. Why? It's because of the sudden change in temperature. If a person has pain, that can trigger a crisis. Basically, the person with sickle cell disease, their threshold, their takeoff point for stress is reduced. Kind of like with asthma too, but let's not get into that. The takeoff point, the trigger, the ability to withstand stress is reduced in sickle cell disease. And so I just kind of like drew a picture here just so you can see the different things, but it's certainly not one thing or the other. And so it's very important that you have an awareness of what your child or you as a person are particularly prone to.